Okay, this is the musculoskeletal assessment for health assessment 2. Come on in. Alrighty, so first I'm going to introduce myself. I'm Brenda Lynn. I'm going to be your student nurse today, and I'm going to do a musculoskeletal assessment on you. I will do 2 patient identifiers, so go ahead and tell me your name and your birthday.
My name's Krista Williams, and my date of birth is 10/4/95.
Awesome sauce.
19 minutes.
Yeah, we got it. I'm sorry. Okay. As I was watching my patient come in, I assessed her for her posture, her stability, if she was able to keep her balance, her foot position to see whether or not it was inward or outward, or if it was pointing straight forward, and hers was straight forward. And she had a normal gait stride, and she does not use any assistive devices. I'm going to start by assessing her head, neck, and back. So first I'm going to palpate the TMJ. So I'm going to have you just open and close. All right, that seems good. I'm going to kind of inspect and palpate her cervical spine, as well as her thoracic and lumbar. And I will check for a contour or if there's any abnormal curvatures. So I'm going to come down and I'm going to touch each bony process and then in a circular motion all the way down the spine. From what I feel, I feel everything in the right spot. I don't feel an abnormal curvature. I also inspected her joints as well, and I felt no abnormalities. And now I'm going to assess the range of motion and the strength of her neck and head. So I'm going to ask you to look up and back down, and then side to side. Wonderful. Okay, now I'm going to go ahead and test the strength. I'm going to have you push your chin into my palm. All right. Wonderful. Okay, everything feels normal. Now I'm going to go ahead and move to her upper extremities. I'm going to inspect and palpate her joints before I go in to do any range of motion. So you feel your shoulders and your elbows. I assess her wrists and her hands, and then each individual knuckle. Okay. All right. Now I'm going to, since I don't feel anything abnormal, I'm going to go ahead and move into range of motion. So I'm going to have you go do flexion, right? And then adduction. No. Adduction, and then abduction, right? Yes. And then we're going to do circumduction. Okay, and everything looks normal. Then I'm going to have you put your hands up and then behind your head, and then go ahead and bring them back and bring the top of your hand to your back. Wonderful. All that looks normal. I'm going to have you move your arms in and out, both of them. And now we're going to do the Fallon's test to test if there's any carpal tunnel. You're going to put both your hands together at your wrist, but wonderful. And everything, do you have any pain with that?
Nope.
Okay. So now we're going to move on to the lower extremities. I would go ahead and palpate the hips, knees, and then the ankles. So, okay, ankles, and then I do each individual toe. Now I'm going to note if there's any pain or crepitus, edema, or any injuries when I do range of motion. So I'm going to go have you stand up, and I'll have you bring your leg up and down. Let's do the other one. And down. Okay. And then we're going to go straight out with the knee and back down, and with the other. All right, and then can we adduct, wonderful. You're gonna do what is that?
Internal rotation.
Internal rotation and external rotation. Okay, now I'm gonna have you sit back up, and I'll let you move around your ankles and your feet. So circular motion, up and down, inward and outward. Okay, I did not hear any crepitus. I don't notice any edema, and there's no complaints of pain while doing all of these, so I note that there's no injury. I could also do the McMurray test to see if there's any lock knee or if it's giving away. I didn't see or she did not complain of any pain when the joints of her ankles and in her feet. And that completes the musculoskeletal assessment.